Tennis elbow is also known as lateral epicondylitis, and it's the most common cause of elbow pain, mainly resulting from repetitive gripping or wrist extension during activities. It is basically a result of degeneration of the local tendon at the elbow joint. It is commonly associated with repetitive microtrauma from excessive gripping or wrist extension, radial deviation, and forearm supination. The extensor carpi radialis brevis is the most frequently affected muscle. Although it was originally thought to be an inflammatory condition, histopathological studies have shown that there's an absence of inflammatory cells, and it's thought to be more due to a tendinosis, which is a degenerative process. Repeated strain on the tendon causes collagen deposition and proliferation of fibrous tissue, which become vulnerable to repetitive forces, which results in further tears. It mainly affects middle-aged people, and it is almost always curable. Tennis elbow is often stubborn to treat, but generally always gets better. Some exercises can help to reduce pain more quickly and improve the strength and functional use of your arm. Keeping active but trying to avoid the activities that increase the pain is important. In most cases, it's not necessary to have any other investigation other than a physical examination. Together with thorough history taking, some specific tests that we use include the Cozen's test and the Mills test. Ultrasound is an effective, non-invasive and relatively cost-effective imaging method to confirm the diagnosis if needed. Non-operative treatment is the priority and mainstay for most patients. Activity modification is important, and the most important point is to respect pain and have a temporary break from the activity that is causing the most aggravation. Lifting with the palm facing up and avoiding things that result in the palm facing down can also assist in transferring the force away from the extensor tendon insertion. Hand therapy, so stretching and strengthening of the forearm muscles form a very important part of the recovery process. Specifically, eccentric exercises are advised, which involve stretching the musculotendinous unit whilst applying a load. Counterforce brace are also used to reduce the pain by pressing on the forearm extensor muscles and thereby inhibiting and spreading out the load on the extensor carpi radialis brevis, therefore facilitating self-repair. In most severe cases, we may fabricate a wrist brace during activities to limit the wrist extension and thus limiting the activity of the extensor carpi radialis brevis tendon to give it time to heal. Thanks.